I think so.
Yes.
So I'm recording, yeah, I'm recording it to the cloud. So so see, I did see that there was a chat and it did pop up. So feel free to put questions in the chat box, and, and we'll have some opportunities for some questions later as well. And just to give you an idea, also Debbie and Emily did participate in our care coordination training. So if you have any questions about any of the stuff, they also have some of the information. So I'm going to talk a little bit about what's care coordination, because we all use this term. I'm a care coordinator, and it means a lot of different things, I think, to different organizations and different groups depending on what your job responsibilities are. This is a definition that was created for the Agency for Healthcare Research and Quality. So the definition, these are examples of how we coordinate care for patients, establishing accountability and agreeing on responsibility, communicating and sharing knowledge, helping with transitions of care, assessing patients' needs and goals, creating proactive care plan, monitoring a follow up, including responding to and changing changes in patients' needs, supporting patient self-management goals, linking patients to community resources, and working to align resources with patients and population needs. So, depending on where you're working or if you're volunteering in the community, what you do for a client or a patient may vary. It's just important to know what some of the resources are, and understand that some patients may need more assistance than others. Sometimes a phone call is enough, and that's all people want. And sometimes a phone call can be completely useless. And it's important to really assess what the needs are of the person that you're working with, and what their desires are, what their priorities are and goals. So you're working to help the patient, with accessing and advocating for what they need and want. So we're going to start off with a case scenario. I'm going to read this case scenario to you. And normally I have 4 different case scenarios, and we do them in groups, but we're going to do this all together in one group. And then I think maybe what we'll do is have you raise your hand if you want to share, so we're not all talking at once. And this is a case scenario. It's actually a real case that someone I worked with when I worked in home health. Mr. Y is a 90-year-old man who lives with his wife. He has mobility issues and falls frequently. His wife, Ms. Y, is 89 years old and has limited mobility as well. Her decline in function has resulted in her inability to stand in one location and cook meals. The couple are eating frozen meals daily. Mr. Y has a diagnosis of hypertension, dementia, and COPD. Recently, due to difficulty breathing, Mr. Y was admitted to the hospital for 2 days. Ms. Y is feeling overwhelmed as she is the only caregiver and their children live out of state. Prior to meeting with Mr. and Mrs. Y, what factors should be considered? What community referrals would benefit Mr. and Mrs. Y? And I do this scenario first before I share the information, because it just gets you kind of thinking, like, here is a very clinical case, but you immediately can see that there's some resources that would benefit with this family functioning. So what are some things that stand out? Does anybody want to share? Maybe raise your hand. What stands out with Mr. and Mrs. Y? Is this someone that we know, right? This is something I think we can all relate to. I can't see if anyone's hand's raised. Oh, Emily's got her hand. Emily literally is raising her hand. So I think there's a way you can actually raise your hand, and I think that shows up to me. But so Emily, why don't you go ahead and
Yes, so
talk?
I couldn't find the little button for the raised hand. I think that they're both like that. She's declining, and they need help. I would recommend home health, personally, and
When you say home health, what do you think? What do you think would be beneficial
A
with home health?
caregiver.
Someone to maybe help with the
Someone
meals.
to check in, help with the meals, and assist them with the daily living actions that they may need.
All right, I'm gonna thank you, Emily. I appreciate that. And I'm gonna unmute. We did have a raise hand and I just unmuted you. Yep.
Jackie,
Yep.
thank you. Jackie McNeil with the Better Business Bureau. Do you want like actual agencies that if I were to get a call like
Sure.
that, I would suggest Council on Aging, Visiting Nurse Association. I'd also ask if their children are involved with them in any way in order to possibly provide them with a roster of companies for them to consider looking into that. We've already checked the background of the businesses out. Piggybacking on what Emily was saying, where we would have some sort of home assistance if they were agreeable to this. I don't know if Mr. and Mrs. Y are looking for help or stating that they're going to handle it their way and thank you so much. I'm not really sure.
Yeah, you know, sometimes that's a challenge, right? We might go in and have all these ideas what they should do and want them to do, and that doesn't mean that that's what they want to do,
Yeah.
right? So kind of like they say, thank you very much. Exactly. So it's something to always consider. And even though the children live out of state, I think that's a great idea. Really trying to engage them and see if they want to participate. So Deborah, I am asking you. Yeah, there you go. Deborah had her hand raised.
Okay, when my Mary got out of rehab, obviously I needed some help, and we went to our primary care physician, who suggested a home help that he had been working with, because we ultimately were going to need all sorts of other things on top of the help at some point.
Yeah, I always encourage people to utilize that Medicare benefit if they qualify, also for the skilled home health, in addition to paying an aide, because that's a benefit that sometimes the physicians don't always take that step. So sometimes the patients need to initiate that process, and they don't know that they can initiate that process by talking to their primary care doctor. So if somebody has Medicare and they have that home health benefit and they're homebound, then they can definitely say something to their doctor and say, listen, I really could use physical therapy in the house, and or we'd love a nurse to come to the house and make sure we're taking our meds right. Like that's something that the patient can initiate with their doctor. It's then up to the doctor to decide if that's something that they're going to help the patient out with. But that is a benefit that's a lot of people don't realize they can initiate that process, and they also don't realize that the doctor doesn't always think of it. So kudos to reaching out to your doctor and advocating. That is something that that is really important to do. So I am going to move on. So we're going to talk a little bit about some community resources here in Palm Beach County. If anybody's from out of the county, most of these types of resources do exist. I'm just going to check this one chat. Okay. So we have one comment. So they're not safe at home and need help with more than just meals. The wife is at risk of hurting herself as the primary caregiver, and they do not have a team supporting the care needs. Community options and private duty can both be great resources. The primary care is the first line of help, with a 1823 to help understand the care needs and struggles in the home. Public funds help could be necessary. So thank you for that input. And we're going to talk a little bit about some resources that can help link people to the different resources that are being mentioned. So I'm going to start real basic and just say, okay, when we say community resources, what are we talking about? What is a community resource? We're going to talk a little bit about community resources and then providers. And you'll see that sometimes providers can be nonprofit and also offer community resources. So there's a little bit of crossover, but we're going to talk in general terms about just some of the differences between community resources and providers. So a community resource is a social or community service that helps patients manage their activities of daily living. So some examples that might be helpful to someone that is in need of support due to a chronic illness or condition could be food banks, transportation resources, housing assistance, disease-specific organization. An example would be the American Cancer Society, the Epilepsy Foundation, Arthritis Foundation, diabetes, the American Diabetes Association. Those are all examples of disease-specific organizations that have a lot of information and resources for the specific disease that the patient may have. Aging services, so programs that specifically work with different populations, senior populations. There's different nonprofits or county-funded organizations that can assist with all these different things. And then mental health assistance. So, and I'm going to give some specific examples in the future, but there's in Palm Beach County, there's the Mental Health Association. That's a community resource. 211 also has a lot of resources for mental health. Again, that's a community resource. And then religious organizations. It's really important to recognize where patients are coming from, and if they feel that their religious organization is a support to them, then that is, that may be where they want that support to come from. They may not be comfortable going to see a therapist, but they may be comfortable talking with their church pastor. So, it's always important to really work with the patient and try to find out what their goals and what they find is important. So somebody else mentioned Alzheimer's Association. In Palm Beach County, we have also Alzheimer's Community Care, and then the Alzheimer's Association also has some great resources online. So where are the supports? So, I think everybody comes from a different place. I remember the first time the first home visit I did working in home health 20 some odd years ago, I did not know anything, and we did not have the internet 20 years ago. I remembered I ordered this big, thick book from the county, and it had listed all the different nonprofits, and that was how I kind of got my feet wet learning where all the supports were. Today it's a lot easier. We have internet, we have networking meetings such as this. There's a lot of different ways to connect with people, and it's changed, right? Even in the past couple months, the way we network is different. There's a lot of people I'm sure on this meeting that never did a Zoom call before a couple months ago. So, there's all different ways to find resources and connect with people. So one thing we can do if we're working in the community is to build our own community resource directory. If you're working for an organization, that's something that might already be created. So it's always good to ask, has anybody worked on developing some resources that we all kind of tap into? You don't need to recreate the wheel if somebody's already done something. And when I first started out, if I was able to connect with someone at an organization and they seemed very knowledgeable, I would ask them if they would share their resource directory. And that was a way that really helped me kind of get started and eliminate kind of starting from scratch, and it really was a big help to kind of tap into what somebody else had already created. And most people that have developed something or have worked really hard on it and they're happy to share it, it's not that hard to really get those types of things from people. I think people are always willing to do that. So so depending on where you work, the types of resources that you need may vary a little bit. So some resources may be well known and used by a lot of different people, and then some may not be identified, and you may need to do a little bit of research. So just don't assume that because you don't know about a resource, don't assume that it doesn't exist. Sometimes you can call 211. I'm going to talk a little bit about that in the future on this meeting, or you can do a web search. Sometimes I'll just do a Google search and see if something comes up, because you never know. And so it's always, I think a good idea to think out of the box and think about, work from what the goals and the goals of the patient are, rather than what we think the goals are. because they may be two different things. And it's always important to kind of prioritize what, we want to make sure our patients are safe, have access to the care they need, but also that they're being respected and heard, and that we're working, to help them. So what you want to do is, once you start finding resources, is you also want to develop it in an organized way, right? How you want to have the information in an organized way that you can look back to it the next time you have a case or a patient that has a similar need. You don't want to start from scratch again. You want to be documenting all that you're doing, and also keep it in an organized way. So when new resources are identified, you want to be able to work with the different organizations, and also, if you find something online or you find something through 211, it's always a good idea to call the organization. I wouldn't just give a phone number to a client without contacting the organization myself. I think there's nothing worse than setting our patients up for failure when generally when we're working with patients that they've got chronic conditions, they're overwhelmed. If we're in the picture, there's something going on. So the last thing we want to do is overwhelm them and give them numbers that aren't going to be helpful. And there's a lot of different things when you're looking at a community resource. Zip codes, financial criteria, waiting lists. There's all different things that can be barriers to a patient actually accessing the service that's provided. So it's always a good idea to call, find out what people are interested in, and getting that information. So when you're looking for resources, some good information when you call an organization is contact information. Again, limitations, relationship. You want to just establish a relationship with someone that works in that organization. Understand the scope of services that are provided and the process to obtain services. And then if you refer somebody to an organization, it's important to understand if they're going to be sharing information back with you. So you may want to keep in touch, and you may want to know kind of what happens with that referral. And depending on your ability through consents will determine how much information is going to be shared. So you always want to have the patient's consent if you're referring them to an organization. I always try to call an organization in the presence of the patient, so there's no confusion or no misunderstanding. Otherwise, if you give a number to a patient, you never know if they're actually going to call the number, or say they give you permission to have the organization call them. When that organization calls them, they may be confused. They might think it's a telemarketer. So I will always try to make the call with the patient or client present, so there's no confusion. It just eliminates a lot of confusion, and that way we know everybody's on board and on the same page. So this goes to consent, right? We want to make sure that all of the patients that we're working with agree that this is something that they want. You never give a patient's information without their consent, and it's just real critical. HIPAA guidelines, patients' information should not be shared without their consent. And what we think patients need may not always be what they think they need. So it's important to really know, have the patients know what organizations you're referring them to. So tools for outreach, when you're trying to find different resources for people, you want to introduce yourself. You may also be a resource for that organization. So sometimes referrals can go both ways. You need resources for your patients, but these resources also need resources for the patients that they serve. So a lot of times referrals can go both ways. Let me just say, I think there's something in the chat box. Yes, so some other things to consider are types of insurance, income and assets. A lot of times if somebody is insured, I will work from their insurance company if it's a resource that their insurance company might have, and then we work from there. So depending on the insurance, there may be different things that are available through their through Medicare or their supplement. You know, there's a lot of different things that insurance is offered today that they didn't used to offer. So it's always important to keep that in mind. So I'll make sure that Debbie has my presentation so you have these links. I also want to show you on our website, we have a great resource list that has all the hyperlinks on our website, and I'm going to direct you to that after the training because it just has everything alphabetized and it's much more comprehensive. Obviously, I'm not going to be able to go through all the different resources in this little bit of time we have together, but right off the bat, 211 is a great place to start if you are not that familiar with the resources. They've also done a lot with COVID-19 and testing sites, where the testing sites are, what the requirements are for the testing sites. You know, are they free? Are they not free? Food resources. You know, they're very, very good with, you know, the different food resources that are available right now. You know, right now we're at a time where everything is kind of changing. So 211 is definitely a place to go when you're trying to get the most up-to-date information. The Aging and Disability Resource Center, I also have a separate slide for that, especially if you're working with patients in the home. When I would do home health, the first thing I would do when I was with the patient is put a call into the Aging and Disability Resource Center. There's things like home delivered meals, assistance in the home. Say somebody has Medicare, but they don't have B and they might need B and they don't know how to navigate that, or maybe they're 60 and looking or getting close to Medicare age. There's amazing, amazing resources to help them navigate that without, you know, getting misinformation. And again, that, you know, they have a webpage where it has all the different resources that they offer. Alzheimer's Community Care, that's a county-run organization that really is a great resource for patients with dementia. Clinics Can Help is a nonprofit here in Palm Beach County that has medical equipment for patients at no cost. So they receive donated medical equipment, and then you know, people can donate if they're able to, but if they're not able to, they're able to access equipment at no cost. And that's something very unique here in Palm Beach County. Not everybody has that. So you see here that I list a bunch of different things. I'm not going to go through every single one. I think another one that's really important is PalmTran Connection, especially if a patient is wheelchair bound and they need transportation. They can sign up through PalmTran Connection. There is an application process. The doctor does need to fill out a portion. But with that PalmTran Connection, they're able to have transportation for wheelchair-bound individuals, and it's like $350 each way. So otherwise, you know, somebody's going to have to call medical transport. It's a lot more expensive. PalmTran Connection is a resource that not everybody is aware of that can really help someone that's homebound access to their medical appointments and getting the care that they need. So I added this slide. You know, there's an elder helpline. So they assist seniors, adults with disabilities, and caregivers. It's just a great resource if you're working with seniors and you're not really sure where to start. The way it works, if you're looking for specific long-term supports, when you call, they will take the information and then they schedule a callback time. So that's always a little bit challenging, especially when you're working with seniors, because they get a lot of prank calls and telemarketing calls, and when they do this assessment, they do ask a lot of financial information. So when you're putting in that call, there is a way to put another family member. So say the patient has a child that is also advocating for them, it's really important to include another family contact so they're able to get information from family members as well. So disease-specific resources, you know, and it varies from resource to resource how much patient care and information they provide, but this is just a handful of different disease-specific organizations, and it's always worth a phone call or checking out their website. And so some disease-specific organizations will even offer respite care, and that doesn't conflict with, say, if you get, you know, something through the agency, the Aging and Disability Resource Center. These are separate pockets of money where people may have access to care. Also, the VA. When my father was declining and my mom needed more help in the home, we were able to reach out to the VA. He was in active duty during World War II, and we were able to get hours in the home through the VA that was completely separate of his Medicare benefit, completely separate of his supplement, and we're able to get like 4 hours a week to really get some help in the home for my mom, just, you know, with getting him ready in the morning just so she could get a break, and that was very, very easy to do. It was not a complicated application. I did it all online. I avoided doing it because I thought it would be really hard, and it wasn't hard. That's completely different than aid and attendance, which is a pension program that's a lot more involved. But we were able to get him respite in the home just through reaching out to the VA and doing a simple application online. So something, depending on the type of coverage, a lot of these patient discount cards are specific to insured individuals. So a lot of times manufacturers, if somebody has an expensive medication, if manufacturers will have a coupon card. So basically these work in partnership if somebody is insured. That's really the best way to go. If somebody's insured and they have an expensive medication, the manufacturer is where you want to go to see if they have a coupon card that can be used in partnership with medication, with their insurance. I know with some of the Medicare insurances, it does vary what they're able to do, but it's important to know that this is a resource and can oftentimes save people a lot of money. And I always like to share this with people because this is about seniors, but we all, you know, have medications, we all have prescriptions. I have a son who's type 1 diabetic, and through doing work with patients that have diabetes, I didn't know that this existed 10 years ago. And so I just went online. We had a big deductible at the beginning of the year, and I was paying, I could be paying up to $300-400 to fill one script. With this discount card, the max I paid was $25. So, and it was good for 2 years, and they didn't ask me how much money we made. This was just something, if you were insured, that you were able to use, and it was from the manufacturer. That's different than if somebody's uninsured and they're looking at a medication. Sometimes there's coupons through like GoodRx that you don't use in conjunction with insurance, and sometimes you can get a better rate out of pocket than using the insurance. But this is just something I want to make sure. And usually all you need to do is go to the manufacturer's website, and it's very easy. A lot of times they just ask you for your name and email, and then you send it out and get it back in an email. Very, very quick. Another place, if you're looking for disease-specific information for a patient, I am very conscious that I am not a doctor. I'm not an MD. I'm not a nurse. I'm a social worker. So I don't try to diagnose or treat people. And sometimes patients will come to you asking you for advice or asking you what they should do. And it's really important not to do that. It's really important to use information that is vetted, that is researched, that is created by people that know what they're talking about. So the government has great resources on different diseases. A lot of those disease-specific organizations that I mentioned, they have a lot of great information. And I always say, if somebody asks me a question, I always say, that's a really great question. Let me do some research for you, and then let me get it back to you. If I'm in a situation where I have one visit and that's it, I'll mail it to them. You know, there's always a way to get information. Don't feel like you have to come up with something on the spot if somebody asks you for information. So it's always important to just kind of know what our scope is and what we should and shouldn't be doing, and know that there are amazing resources that cost nothing. So all of these resources are online. There's also resources that you can order, you know, through the internet, and they'll send you books and packets, and you know, all the information that you would want to be able to share is available out there. So I mentioned providers. So some examples of providers to give you an idea of what the difference is. Hospitals, clinics can be providers, specialty physicians, mental health providers. So there can be sometimes a little bit of confusion, right? Because a mental health organization might be a nonprofit and offering therapeutic services at no cost, but they're also clinical providers, right? They're clinicians providing a care, maybe diagnosing, maybe providing treatment. So that's where you may see some crossover. Skilled nursing facility, those are providers. Home health agencies are providers. Durable medical equipment. So I wanted to just spend a little bit of time talking about the resources in Palm Beach County Healthcare District, and we may have some people from other counties. So Healthcare District is really the only thing that's on here that's specific to Palm Beach County when we talk about resources. And I just wanted to share this because Palm Beach County is a little unique that we voted in years ago to have this indigent care. And we support people that are indigent, low income population through this healthcare district fund. And district cares has changed dramatically over the years. So a lot of times people will have applied years ago and they're like, oh, I don't qualify for that. I applied and I got denied. But it has changed dramatically over the years. Now in Palm Beach County, if you're 100% or below the poverty line, and so for one person, figure that's about $12,000 annual income. If you're below that, then regardless of citizenship, residency, healthcare district is able to provide this district cares program. It used to be that you could fill out an application either through a community partner like our organization, or you could get the application online. That's not how it works. The only way you can have access to this district cares program is if you go to healthcare district through one of the clinics, and then the healthcare provider assesses that you qualify for this district cares program, and then they will schedule you to do an application within the organization. So typically what we found is the people that do qualify, or patients that need specialty care, or that have a specialist that they need to see. So through this program, it's sliding scale through the district cares for primary care, and then the specialists that, if they're approved for this district cares program, they're able to see that specialist at no cost. And then there's a certain amount of hospital visits that are at no cost, but it's very, very limited. It is not every specialty, but that does exist, and it has changed. It used to be that you had to be a citizen or a permanent resident. That is no longer the case. They don't look at any of that. You do have to live in Palm Beach County. You have to be a resident of Palm Beach County, but you don't need to have the legal status of permanent residency or citizenship in order to qualify for that. But it is only 100% and below. A lot of confusion around that because it's changed so many times. But and if you have any questions, you can always give me a call after. So Medicaid in the state of Florida is very different than other states. And a lot of times people will come from New York or New Jersey and they think they're going to come here and get the same benefits that they had. And Medicaid in the state of Florida, unless you're 21 and under or 65 and older, it's really hard to have that full coverage of Medicaid. So the Department of Children and Families determines eligibility. The way people can fill out a Medicaid application is either online themselves. They can go online themselves, or they can work with a community partner. Our organization actually does help people apply for Medicaid. If people have straight Medicare, they are able to apply for Medicaid as that secondary. A lot of people don't really know that or think about that, and it's going to depend on income, but some people may qualify for Medicaid as a secondary, which is different than, say, Humana HMO, where they basically take that Medicare benefit and kind of manage those funds. So some people do have Medicare as straight Medicare as their primary and Medicaid as the secondary, but they would need to fill out an application in order to do that. And again, sometimes what happens is people opt out of, you know, the Medicare, they'll say that because they don't want to pay that fee, I think it's B that there's a fee for. And the Aging and Disability Resource Center is a great resource to send people, say they haven't been paying in, but now they need that benefit. The Aging and Disability Resource Center can help them navigate that application and avoid penalties, because sometimes people will be penalized if they at a later time decide to, you know, enroll in that B. So what happens in the state of Florida is a share of cost for a lot of adults, and the way the share of cost is also medically needy is really only for women. So it's even more difficult for adult males to access any type of Medicaid than adult women. If a woman has minor children, then she may get what's called this share of cost. And then, oh, and then someone just wanted to comment, a spouse can be eligible even if their other party makes too much money. So that's interesting. I have heard that people have challenges if they're married and their group income is too much. But so I think the bottom line is it's always worth applying. You know, and then either people get denied or they get accepted, but a lot of times don't think of applying. So it's always worth putting an application in, even if you don't think you'll qualify. So I think it's hard. I still can't even figure out why some people get approved and other people don't, and they'll look on paper to me identical. So you know, it's always worth applying and making sure you have all your documentation. So this is just an example of who actually is able to access Medicaid. So individuals potentially eligible for family-related Medicaid include pregnant women, parents, and other caretaker relatives, infants under age 1, children under age 19, and children 19 to 21. One thing that is important to know, that what happens when somebody turns 18 is they will get a letter saying their Medicaid is ending. So people don't realize that they can reapply for up to 21. So a lot of times people are like, oh, I just got this thing, I don't have Medicaid anymore. It's basically the eligibility requirements, I think, change a little bit, which is why they require you to reapply. So once you do that application, you may get share of cost instead of full Medicaid. But if you have a chronic condition where the medications are very expensive, you may be able to meet that share of cost with the medications that you're on or the care that you need for that chronic condition. So again, you know, it's always worth calling a community partner or doing the application online if you're able to do that. So citizen eligibility, can immigrants or non-citizens qualify for Medicaid? So a lot of times people assume you have to be a citizen to access Medicaid. You need to have legal status for 5 years for adults in order before they can apply for Medicaid. It kind of keeps changing, specifically also with children. But for adults, you definitely need to have a 5-year window of legal status here before you can apply. If you're a refugee, that's different. Refugees are able to get Medicaid right when they come. If you're applying for refugee status, that's not the same thing. So if you come here as a refugee, Medicaid is really part of that. They do give you Medicaid, but applying for asylum and all that, until you have asylum, until you have permanent residency, that 5-year window does not start. And that goes for SNAP benefits as well. So unless people so somebody, yes, it's called the community spouse applies for the long-term care Medicaid waiver. So that's different than the Medicaid that I'm talking about. The long-term Medicaid waiver has to do with long-term care. I'm talking about the health insurance benefit. So long-term care Medicaid is really different than healthcare coverage Medicaid, which is what I'm really referring to here. So there's different types of Medicaid as well, which you know, is also another, so it can get very, very confusing. So if you're talking about the long-term care, that's different than health insurance Medicaid. So all citizens that meet other requirements are eligible for Medicaid. So again, there's a financial cap on Medicaid and as far as what people are going to get, that really, so if somebody's doing a SNAP application, which is food stamps, it looks a little different than if they're doing a Medicaid application for health access. And so the criteria is going to be different, and they really do look at financial income to determine what people qualify for. And again, I'm going to have my slides available to Debbie, and anybody who wants these, you know, you can access them. So kid care, a lot of times people don't think about kid care, but kid care is a great route to go. Say you don't qualify for Medicaid, you make too much money. Anybody can access kid care, and especially right now with COVID-19, a lot of people are being laid off. So you might even be in a home working with a family, and say you're there to see that senior, and the senior is living with their children and grandchildren. They might have children that were just laid off. You know, it's going to impact the entire family when access to care is missing. So kid care is another great resource where people can access insurance for children. There is a fee. It's not free and it's not cheap, but if somebody has a condition and they need to be cared for, it's a great route to go. And also the marketplace, maybe it's a married couple and you know, they're still 100% above the criteria for insurance. It's definitely worth looking at the marketplace, especially one of the things when somebody's let go, that's a status where open enrollment isn't required and people are able to apply for an Affordable Care Act plan. So Medicare is our country's health insurance program for people 65 and older. Certain people younger than 65 can qualify for Medicare too, including those with disabilities and those who have a permanent kidney failure. So it's important to know that when somebody applies for Medicare, or when they apply for disability, right? When somebody goes to the Social Security office, they apply for disability. Even it's going to be 2 years from when that application goes in until that Medicare is going to kick in, except for cases with certain conditions or diagnoses like renal failure. So it's important to know that a lot of times people will think, oh, I applied for disability, I'm going to get health insurance. And you know, that was one of the things that I was surprised to learn when I first started out, that there is a 2-year window where people, you know, will not actually have that access to that Medicare. So a lot of times people don't even say, oh, well, why should I bother applying for disability? Well, that's one reason they should apply for disability, is to get that clock ticking on that 2-year window. They can still apply for Medicaid, and depending on their income will really determine if Medicaid will be something they're able to access or not. And if their income is too low, then, you know, district cares is really where people should be looking for that care. So Social Security disability benefits, you know, you must first have worked jobs covered by Social Security. So a lot of times people will ask if they can apply if they haven't worked. And so this kind of covers that. And you have to pay into the system in order to take out of the system. And you must have a medical condition that meets the definition. So in general, we pay monthly cash benefits to people who are unable to work for a year or more because of a disability. And so people can apply online, but really at some point you're going to have to go in person to submit certain documents. So a lot of people don't realize in our county, we are very rich with resources, with community clinics. A lot of times there'll be people that you know, don't really want to pay the money for Affordable Care Act because the copays and deductibles are really high. There's a lot of people in that window of 60 to 65 where maybe they don't qualify for Medicare yet. Medicaid doesn't make sense. There's a lot of federally qualified health centers and free clinics that can help people access primary care. The organization I work for, we're part of that free clinic network where we help patients with specialty care that meet the financial criteria. So this is a very, very brief overview of the different clinics. There's a couple different kinds. There's federally qualified health centers. Anybody can go into a federally qualified health center and access care. and they actually help a lot of people with Affordable Care Act plans, but you can go and pay out of pocket at any of these federally qualified health centers, and you're going to pay a sliding scale fee based on income. So typical rate would be $25 for a primary care visit, $25 for labs. That's a lot cheaper than somebody going to a physician in the community and paying out of pocket. So it just depends on, the patient and the needs as far as, what they're comfortable with. Healthcare district does have a lot of federally qualified health center clinics throughout the county. If somebody has a medication that is expensive and they're, I always will direct them that route because they may be able to get their medications at no cost through healthcare district. So, when you're talking about pharmacy benefits and somebody's got a medication that they need access to, that may be the best route to go. The free clinics, there are no fees charged. However, you have to be 200% or below the poverty line. So 200% is for one individual would be $25,000. About their income needs to be $25,000 or below, and they can go to any of these free clinics, set up an appointment, and be seen at no cost. So Caridad, a lot of people have heard of Caridad. Caridad is a great free clinic. There are other free clinics throughout the county, and this is some a list of free clinics that are available. And then also we have several hospitals that have residency clinics. So FAU Community Health Center, the FAU has a residency clinic down in Boca. And then JFK has a resident clinic at, those are University of Miami medical students. And then FAU are students from FAU. So that's also places where people can go and have very reduced rate care. Primarily all of these places that I mentioned are primary care. Some of them will have some specialty relationships where they may be able to have low cost or free care. Our organization here, we take referrals from the community and we help people access care, specialty care. So if people don't have medical homes, we'll help them figure out if they qualify for anything. If they qualify for anything, we'll help them access that, help them find medical homes, and then that medical home can then refer them to us for specialty care. So this is our organization. This is one of the things we do here. Again, we fall into that free clinic network, so it's 200% or below. People are able to access care through our organization. We're actually also going to be starting we just received a fund through the Promise Fund, and we're going to be doing breast and cervical cancer screenings and education, and really helping people access care that haven't had mammograms or pap smears. We want to make sure that people have access to that. So that's something we're just starting up that we're real excited about. So I think, I've given you guys a lot of information. Again, I'll have the slides available. You can always, Debbie, let's make sure we give everybody my contact information. If anybody has patients they're not quite sure what to do with and they're scratching their head and somebody called you and you don't know what to say, you can always give us as a referral. We're always happy to help patients figure out where the best place is for them to get care that they need. We get a lot of calls. I don't know if you've heard the term social determinants of health, but more and more research is showing that, patient care has a lot to do with all those other things, the transportation, the food, the, social supports, disease supports. All of those things really can impact a patient's outcome. So it's important to know what those resources are, or at least where to have people go if you don't know where those resources are, so patients can get the care that they need. These are all things that we encounter, right? The zip code isn't the right one for a program. The needs assessment wasn't high enough. The phone number changed. And then also, what if somebody doesn't think they need care? I can't tell you how many times when I worked in home health, the nurse would send me out because they said the patient needed home delivered meals. And I get out to the house, and do you think that the patients want home delivered meals? So, because it's like $5 a meal, right? And so they don't want to spend the money. And so, it's wonderful that, and they would do better with those meals because they're, they're frozen fresh, they don't have sodium. But you know, just because I think that the patient needs the home delivered meals and the nurse thinks they need the home delivered meals, sometimes it can be a challenge getting them there. That's kind of an example of they may or may not be on board with thinking they need this support. So this is just some ideas on how to engage patients, keeping their goals in mind. Remember that patients and family caregivers may say no, and that's okay as long as, you know, it's not a safety issue. Stay task oriented when making plans. You don't want to get overwhelmed or overwhelm patients with a million different phone numbers because it will be overwhelming. I always try to say, think of how to prioritize the needs based on what the patient wants and safety, and really kind of work on one or two things at a time. If you try to work on 5 different things, you're going to lose the patient and you're not going to accomplish anything. And really, if you can focus on, if it's a trust issue, if they're not really trusting you, they're not really on board, if you can spend time really building that trust and maybe focusing on something they see as more important, then the other things that you think are priorities may come a lot easier and quicker if you kind of establish that trust and make that connection. So depending on you, maybe you're the type of person that there's no line, right? And you just do everything because you have a heart of gold and you're very empathetic, and you'll do anything for your patients. And then there's other people that say, you know what, it's not my job, it's not my role. I'll just have somebody else go out, or I'll give them a phone number. That's not really what this is about. So people really come from all different places, and you know, depending on your organization structure, their mission may determine how much you're able to do, how much is appropriate to do. If you're not sure, always talk to a supervisor to really say, all right, this is what I'm thinking for this patient. Is this something I should be spending time on? What do you think I can do to help the patient, but also make sure I'm meeting my goals? Sometimes that can be a challenge, right? Is kind of knowing when, you know, what is your scope and what is your role, and always talk to your supervisor if you're not really sure. And going back to safety, I didn't really get into like the elder helpline, but you know, you call 211 if you're not sure who to call. If a situation's not safe, they'll help you. I mean, you can just Google it, you know, hotline, elder abuse hotline, and the number will come up. And if you're not sure if something is a safety issue, you can always call and say, all right, this is the situation. Is this a safety issue that I should be calling in? And they can help you figure that out, or your supervisor can help you figure that out. You know, it's always important to get some feedback and ideas, and sometimes something that's a safety issue can be, sometimes people don't know the resources exist. And so sometimes resources can make the difference of a family or a patient being able to stay home. And there are a lot of resources and supports in our county that exist to help people stay home safely. So it's always worth exploring what is out there to support the families and patients, to see if we can help people, you know, have a high quality of life and be safe. Any questions?
I see there are 2 hands raised.
Oh, okay.
Jody and Deborah.
All right. So let me just put this last. I'll just put that on. So let me see how I see the. I don't see the hands raised. So Emily, why don't you help me?
Jody. Oh, Jody and then Deborah.
All right, Jody, why don't you unmute yourself?
Well, hi, I was actually had raised it earlier when you asked us a question. So
Oh, sorry.
it's a
Sorry.
lot of information. I really
It
appreciate
is. It is overwhelming. And then Emily, where did you see the other hand raised?
Deborah, but it looks like she's away from the computer right now. Oh, nope, she's back. Deborah? Do you want to unmute?
I don't have any question. Sorry.
Oh.
Any comments?
No, Karen, I think you had a great presentation. Thank you very much.
Well, you know what? Let me just real quickly, I do want to show you the link to our website. Can people still see my screen?
Yes.
Okay, so I'm going to show you our website. We had an intern that spent a lot of time on this, so it's a great resource. So this is our website. It's pbcms.org, so Palm Beach County Medical Society. So if you look at this and you go to patients and you go My Health Access Community Resources, so we had an intern come in and update all this information. So this is broken down by category. So like if you say I want Alzheimer's disease, if I go to Alzheimer's disease, there's 4 different resources, and then I click on there. Oh, it looks like they changed theirs. We need to update that. But so then I'm able to go right, they're all hyperlinked to the web pages. So if we go to another one, let's see, cancer resources. So these are all the resources for cancer here in Palm Beach County. And Cancer Care is a great, great resource. They have a lot of, they have kind of like how Alzheimer's Association has 24-hour care. Cancer Care has, I think, online therapy available, great information about disease-specific brochures they'll send you, you know, just all different things. So this is just we had an intern that spent quite a bit of time on this. So it may be a little bit dated. It was about a year ago. So like you saw, that one link didn't work, but so you just go to our website, go to My Health Access, and then that's how you click on this. And that's it. Oh, there's some more chats. Let me see. And I think Debbie had some information. I think that's about Allegiance. So I actually I used to work for Allegiance and did their social work visits. So, and my dad used them for years. So anyway, that's how we're all connected.
So thank you, Karen. This is Joe talking.
Hey, Joe.
I don't know. Hey, Karen, that was fantastic. That was a great presentation. I mean, I like the share screen thing worked out really well too, but thank you. I appreciate that. That was very informative. Good stuff.
Good. I'm glad you learned something. You think you learned anything, Joe?
Of course. Karen, you're always teaching me stuff. What are you talking about?
Okay, so if anyone wants any information, I'll throw up, not throw up, but I'll put up my information in the chat box, but most of you probably have the information because you emailed me for RSVP anyway. So, but it was a great presentation, Karen. Thank you very much.
Good. I'm glad you enjoyed it. I always love seeing you guys and working with you, and I hope everyone has a fabulous day.
Thank you. That's good, everyone. And I'm going to put this up right now. We also have another presentation coming next week. Oh, but I can't share that screen right now. Okay. Karen, can you hand the host back over to me?
Sure. If I can figure that out.
Just put it on my name, hover over my name, and then go over and it say make host.
All right, hold on. I got to find you first. There we go. There we go.
And I went ahead and put my information in the chat so that you guys have that. And then yes, this is you. And then we have another presentation with Stephanie Schneider, the dangers and pitfalls of applying for Medicaid and VA benefits yourself. So she's going to do that presentation for us on June 10th, which is next week. So if anyone wants to join, we'll send that out. We'll send that out via Constant Contact, and I think right after this presentation. So if you're on our Constant Contact, you'll get it, or you can just let me know via my email that you would like to join, and I'll send you the link. But thank you very much. We'll probably put this video up on our website, on our blog, but I'll send you the presentation and Karen's contact information if you request it as well. Okay, I'm gonna go ahead and end the meeting. Thank you, Karen.
Thank you, Karen.